and the school completion programme is potentially very exciting. Because I think one of the things that people would say is that in the past these services have operated quite independently of each other, and the idea that we could put something in place to connect them is extremely welcome. And as I said earlier, the involvement of youth work professionals I think is a particularly valuable aspect of this particular programme. So I said earlier that I wanted to talk about just 4 key themes, because I know it's quite a long morning and have more work to do, and how I thought it might be interesting to maybe talk about what you're doing here connects with some of the big themes that we're trying to develop nationally, and which, to be honest, is quite a job of work to do. You know, we really need all the help we can do, we can get to do that. So the 4 themes that I just want to talk about briefly are evidence-based practice, and Marie's already alluded to that. The work that the office is doing in supporting prevention and early intervention, which I think is very, very exciting. The integrated working and thinking about public service, in which I have a particular interest. And finally, the building of family and community resources. So those are, and integrating them. So those are considered the 4 things that are the 4 main topics. I want to maybe put out some thoughts and be interested in your feedback. So the first issue and theme that I wanted to discuss briefly is evidence-based policy making, and in particular the work we've been doing on prevention and early intervention programme. And I think it's fair to say, sadly, that our recent history is littered with examples of projects which have sought to improve outcomes for children. But we don't know whether they did or not, because as they started out, they did have a robust, systematic, conceptual framework with identification of need, focused indicators, you know, a commitment to careful and precise implementation of the programme, and a rigorous evaluation framework. And we saw that in a number of interventions, particularly I think in the 1980s and 1990s, and we were left with answering questions like, what worked here, what didn't work, what did it cost, what will we do next? So I think people came to the realisation that we needed to structure these questions in at an early part of any intervention. I think that's been one of the big learning points over the last number of years. So as many of you know, we've been working with the Prevention Early Intervention Programme for Children, and it's jointly overseen by the office and working in partnership with Atlantic Philanthropies, and it's a really, really important programme, I think, for children in this country, because not only does it focus on what happens in the individual sites, the idea is to take the learning from those sites and mainstream them into the wider policy. As I say, much more easily said than done. We also have, again, sadly, the reality that we're facing severe economic constraints. That's just the sad reality that we face. It's probably going to become more difficult before it gets better. So we've been trying to develop programs which are strongly rooted in evidence base, which provide value for money, and which we can see very clearly what the outcomes for a given investment of resources is, because that's actually going to be much more difficult and much more important over the next decade as we try to focus very scarce resources on real need. So we have to identify the real need, identify what questions it is we're trying to address, and how we're going to use our resources to do this. And it's important that we have a structure to do that, and that's why I think the work of the Prevention Early Intervention Programme is very important, because it gives us a rigorous, systematic evaluation against outcomes for children, and helps us to understand what interventions work, what are required what's required at national level and at local level, and that we get a good return on our investment. So working with the Prevention Early Intervention Programme and the P programme, which is being run in Longford and Westmeath, which I think Archways has a good connection with, we're trying to establish a model of practice where the evidence of need in the community and the evidence base of what works is developed into a coherent policy response. I mean, that's essentially what we're about. It builds up from the experience that people would have at local level, that professional, personal experience. It takes into account, builds on, integrates research literature from successful models tested elsewhere. It links up with needs assessment on the ground, and they all come together to inform policy development. And as many of you know, we've put, and Liz particularly, have put a huge effort into supporting and developing, mentoring indeed, this programme. And the office has been closely involved in many aspects of this over a prolonged period, because I think we all know that that the connection between what's happening on the ground, as I say, to the policy pathway, it's not as linear as it might appear. We sometimes do have to go around the houses a bit to get good results. So that is one aspect of the work that we're doing at national level, which is highly relevant to what you're doing here. We are anxious that the work, the evidence on the ground would help us to reorient current services. It's going to be necessary anyway because of affordability issues. So what we're trying to do over the next while is to ensure that as the lessons emerge from the work on the ground, they're fed in very directly into the policy on current services. So that evidence base is one extremely important pillar of what we're doing. The second pillar that I just wanted to mention to you is the prevention and early intervention strategy itself, which is based on early identification of need. So the younger that you can identify need in a child, interventions can then take place earlier, so they have a better chance to succeed, and hopefully at least they will be less complex and less expensive to deliver. That's the theory. So we have a chance here on the ground to actually make that into one of our policy, another policy pillars. We've seen over many years, indeed decades, that the absence of early intervention was detrimental, catastrophic, as I say, in some cases. And we know that the earlier you can intervene, the stronger the impact on the outcome for children and young people. And we have, as a country, I think, in place quite a lot of programs which are relevant here. We have developed a lot of early education and care programs. And indeed, my own office, I'm delighted to say that in the recent ECHE scheme, which started in September, that's the early child care, I always get that confused, early child care programme. We have 95% of the age cohort have now signed up for that early child care programme. That's 63,000 children are in the programme. It's a phenomenal achievement, and it means that we have in this country almost unnoticed developed something that we've said that we've wanted to do for many years, which is to develop a strong, high quality preschool sector, and we've done it. The challenge is to keep it and to build on it. And it gives us, I think, it contributes to our ability to intervene early with children in a range of services, including language literacy and pro-social behaviours. And it's tremendous potential, I think, which we're only beginning to recognise and which we would want to work with people on over the coming years. So we're very committed in the office to early intervention. We will have, I think, a big challenge in convincing the system, which traditionally didn't invest in this area, that this is a good and worthwhile investment, particularly in the context of very scarce resources. So we'll be looking to the experience of a whole range of programmes to help to work out how to mainstream more effective interventions in early childhood. The third theme I wanted to address, which is close to my heart because I worked for a long time on public service reform issues, is on integrated working across agencies and between agencies of the public sector and the voluntary and community sector. And again, Tony and I have worked over the years on a number of issues and trying to move on some agendas in that area. We know that the integration of services is important. We know it's not just for resource issues. We know that there's better outcomes if people from different perspectives and services work together. So we've been working in the office on the Working Together with Children initiative. We've done, I don't have time this morning to go into all of the details